Hey everyone, thanks for joining me today. Today's video is going to be a little bit different than the ones I've made in the recent past. Today, I want to spend a little time reviewing what it's been like to practice medicine for the past year during a global pandemic. I also want to take some time to pay tribute to the over 3,700 healthcare workers who have lost their lives fighting this terrible disease. And then finally, I want to pose a challenge to all of you and what you can do to help us end this pandemic and get back to the way life used to be as quickly as possible. All right, let's get started. When I decided to become a physician well over 20 years ago, never in my wildest dreams did I imagine that I'd be practicing medicine through the conditions that we've endured for the past year. I bet none of you expected it either. Last spring, all of our worlds changed in an instant. SARS-CoV-2, the virus that causes COVID-19, began to circulate around the world and started to disrupt our lives like we could never imagine. Seemingly overnight, businesses shut down, schools closed, we all raced to the store to stock up on essentials, and public health professionals were begging us to stay home and do what we could to help contain the spread of this virus. It's a huge understatement to say that we were woefully unprepared as a country for what we were about to deal with. As healthcare providers, we were facing a disease that we knew very little about and essentially had to make it up as we went. We acted on the best data that we had and made the best decisions that we could. I'm not sure that I've studied any more about a single disease than I have about COVID-19 over the past year since I was in medical school. Thankfully, over time, the science has improved and research has begun to point us in the right direction on how to best treat and contain this terrible virus. It's just a shame that it had to play out on the nightly news for persons who really don't understand how science and medicine evolves over time, in this case, faster than it ever has before. Sure, claims were made early on, unfortunately based on the best data that we had at the time, that have now since had to be walked back. Originally, we told people not to wear masks. Now we're telling everybody to wear masks. Science changes over time. We learn more, we understand how to contain the virus better, and we update our guidance to patients just as we do for other diseases. That's why those of us in medicine are considered lifelong learners. We update our guidance, we update our treatment recommendations, and we update what we tell patients over time as we learn more and more about different diseases. COVID-19 has been no different. I joke with my patients all the time that if we got it right the first time, all the time, we wouldn't call what we do practice. Thankfully, we saw a global effort by all those involved, including physicians, scientists, healthcare companies, and governments, pour all they had into learning about the disease, learning how to treat it, and ultimately learning how to stop it. We also leaned on tried and true public health measures, like you've heard over and over again for the past year. Wash your hands, wear your mask, and the new buzzword, social distance. In my practice, I went from a schedule that was busting at the seams to barely seeing anybody in the office in just a matter of a couple of days. Luckily, my health system implemented telehealth in just a matter of a couple of weeks to allow us to take care of as many patients as we possibly could. We got very creative in how we did things. We were doing drive-by testing, seeing patients in the parking lot, whatever we needed to do to take care of our patients in a way that they were comfortable with. All just to try to keep patients from putting off needed care. At the same time, we were dealing with shortages of everything from PPE to medications to supplies to hospital beds and even staffing at some point. Thankfully, I work for a healthcare system that was pretty well prepared and was able to act quickly when it came time to add capacity in our urgent care, emergency room, even in our hospital. We bailed out entire units in a matter of weeks to take care of patients who needed us. We even had physicians volunteering to work in the urgent care, emergency room, and even back in the hospital if we were needed. Truly doing whatever it took to take care of all the patients that we had before us. During some of the surges, it was nothing for me to see over 40 patients in a day. trying to take care of everybody as best I could. Now, one of the things that we're really starting to deal with and is becoming increasingly frustrating for both patients and physicians is those COVID patients who now have the long COVID or long haulers, as they've been referred to, where they have symptoms of COVID such as fatigue, shortness of breath, brain fog, etc., that just doesn't seem to want to go away. And the most frustrating thing about this is we really have nothing that we can do for them. There's some supportive care we can offer, but it's extremely frustrating to patients and physicians because we really still don't understand this aspect of COVID-19 and how to care for it. That's one of the reasons why I get really frustrated when I hear people comparing COVID-19 to just another flu. I can assure you, it is not just another flu. I've never seen a flu virus have this type of effect on multiple organ systems and stick around for this long. During the past year, one thing has remained consistent, and that is, no matter what odds were stacked against us, healthcare providers, nurses, techs, physicians, everybody else involved in healthcare showed up every day to take care of patients, no matter whether they were being ridiculed or mocked for asking people to wear masks or stay home if they were sick. We still showed up every day to do our jobs. They did so at great risks to themselves and to their families. Not because people were calling them heroes, but because for most of us in healthcare, this is a calling, not a job. Our CEO likes to attend our new employee orientation and hear the stories of why the employees have joined our healthcare system. And many times, it's personal to them. They've had a loved one cared for in our health system, they've dealt with disease or healthcare needs themselves, and it drew them to medicine. Most of us don't get into medicine just because it's another job. Frankly, a lot of us, especially physicians, could probably go do something else and make a whole lot more money and have a whole lot less stress. But we chose medicine because we believe in it and because, like I said, it's a calling, not a job. And frankly, I don't expect those of you who aren't in medicine or those of you who don't know someone in medicine to understand that, and that's okay. Healthcare workers, unfortunately, have been impacted by COVID-19 more so than many others, not only physically from contracting COVID-19 themselves, but also mentally. Recently, I've had the opportunity to talk to a few of our COVID ICU nurses who also happen to be patients of mine and listen to their stories of the nightmares that they experience due to the amount of death that they've seen from this disease. Sometimes many patients dying in a single day. And unfortunately, during the height of the pandemic, they really didn't have time to stop and process this, but now that things have slowed down a little bit, they're really starting to struggle with this. You might imagine if you'd seen so many people die from this terrible disease despite your best efforts to save them, that might have a little bit of a mental toll on you. And unfortunately, as I mentioned at the beginning of this video, we've also had over 3,700 healthcare workers lose their lives to COVID-19 themselves. We owe a huge debt of gratitude to those healthcare workers who literally put their lives on the line to save others. So, now it's your turn. Thanks to the heroic efforts of scientists around the world, we now have some of the most safe and effective vaccines that have ever been developed available to you to take today to help us end this global pandemic. So, unless you're truly allergic to the vaccine, or you've been told by your physician that it's not safe for you to get the vaccine, it's time to put aside the political rhetoric, stop believing the armchair scientists who have done their 15 minutes of Google research, and stop believing all the lies, roll up your sleeve, and get the vaccine. It's just that simple. Now, please don't fill up the comment section with all the lies that people want you to believe about the vaccines. I've seen most of them. In fact, if you want to check them out, go visit my video that I made about my second COVID-19 vaccine and you'll see most of them. Despite what some might want you to believe, the vaccines that we have today are very safe and highly effective. Sure, some people will have an allergic reaction. Unfortunately, people have allergic reactions to different substances every day. There will be some people who will have mild side effects, fever, headache, achiness, that will be short-lived and, trust me, better than getting COVID itself. There may also be, unfortunately, a few people who have more serious side effects. We live in a world where just being alive, there are risks. But based on the best evidence we have to date and the millions and millions of doses that have been given around the world, the benefits of this vaccine truly, by far, outweigh any risks that might be out there. Sometimes, unfortunately, bad things happen to good people. But getting COVID itself also comes with risks, and bad things can certainly happen to you if you get COVID. So, if you want to get back to your normal life, if you want to get back to seeing your elderly parents or grandparents face to face without a window in between you or without masks on, you want to get rid of the masks completely, and you want to get back to just life as the way it was, this is the way to do it. Get your vaccine. Plain and simple. There's a light at the end of the tunnel. I'm pretty sure it's not a train anymore. But it's going to take everybody rolling up their sleeve and taking the vaccine as quickly as we can to avoid this pandemic from getting any worse and ending as quickly as it can. All right, that's all I have for you today. I hope you've enjoyed the video. Thanks for sticking around if you've made it this far. I hope you'll consider subscribing to my channel for more videos in the future. Take some time to hit that like button. And as always, be safe out there.